Not many people know that I've ever been raped or how I even got on drugs. I lost everything. I lost my job. I lost my home. I lost my children. I got suicidal.
Over there by the pharmacy is the main waiting room, correct? Mm-hmm. Oh, yeah. Thank you.
I grew up in an upper middle class home. I was taught morals. I was taught how to be a good person. I think drug addiction can affect anyone. I think it's an illness, a sickness, and a disease that can be treated. It could happen to anyone.
Thank you.
You came from a really rough place.
Came from the bottom to the top we came. With therapy.
With therapy.
Yes.
You put me through it a couple of times.
I did, with the relapses.
All right, well, I'm so proud of how you've done. And you handled this illness as well as anybody can handle. I love that.
Thank you.
I love it. You deserve it.
I did.
Dr. Treisman was seeing HIV patients when they said, A, there was no point, they were going to die anyway, so why treat them? And B, that, how could you give patients medicine because they were on so many different combinations of things, they just won't work. The interactions will be crazy. And Dr. Treisman, he said just because something is difficult and just because something is hard does not mean you shouldn't do it.
The question is, what do patients need? Because if you look at the HIV patients as a group, someplace about 55 to 60% of them have a psychiatric disorder, and HIV doctors have zero training in psychiatry. And psychiatrists have zero training in infectious disease. So who takes care of those patients? Well, nobody. They get kind of what we call carved out care. The psychiatry cares over there, the HIV cares over there, and the HIV doctor gives them a benzo, and the psychiatrist tries to get them off of benzos. Those niches are the place where our healthcare system falls down.
I have to juggle HIV, I have to juggle the status of my diabetes, which is really bad, pain in my back, I suffer from migraines, and major bipolar depression. So it's a struggle.
Her most pressing health issue sometimes is really her diabetes. Her HIV can be well controlled. Psychiatrically, she could be well controlled. She could be sober. But if there's a weakness in a system, that's just as important. You need to take a holistic approach.
He was doing it before anybody knew that it was out there. I mean, that the problem existed. He saw it before anybody else. He was a visionary from that standpoint.
She has pneumonia and a UTI.
And I think that he was quite ahead of his time in terms of his work and what he was attempting to do to make a difference in the community.
We treat the patients that fail out of other programs. The environmental barriers to these patients receiving care are enormous. And just getting to the clinic, living in an appropriate place, being safe. All these things they battle on a daily basis. Those patients are vulnerable.
The problem is that it's right in front of you and you don't see it. So you're serving a population that's not seen.
And under the influence of deliriogenic illnesses. Well, the biggest problem in healthcare is the way it's funded. The funding is directed at little pieces of getting that patient better rather than the whole patient. Funding for patient care that's directed at getting the whole person better, getting people to flourish, seeing that as the goal rather than to fix their appendix, is much more necessary for these complex comorbid patients that we see. And if we get funding for that, as I've shown in our clinic over and over again, we have turned people's lives around. People who everybody thought could never get better have gotten better. And you can teach people to do those things.
It's usually cliche to say that, somebody wrote the book on something, but actually, Dr. Treisman and Dr. Angelino did write the book on AIDS psychiatry that people use all over the country. We must get hundreds upon hundreds of applications every year. We've trained counselors and nurses and psychiatrists, that are all over the country.
The people that live in our community, in our city, would not survive if it were not for the clinic.
He's able to, with his program, turn their life around and get them off of heroin, control the HIV, and have them have a productive life. That's making a difference.
You need philanthropic people who understand your mission, and Tony's been one of those people for me. Tony goes out to people and says, look at this amazing thing that's happening at Johns Hopkins. It's not just a place where people go to have conjoint twins separated. Day to day, week to week, people from the city who have failed everything are getting better because of the tireless and unsung work of doctors who are trying to take care of sick patients.
If it were not for Dr. Treisman, I would have killed myself a long time ago. I've learned to like myself. I learned that I'm a good person. I'm a beautiful person. I'm an exceptional person. So, and I needed to learn that.